Platelet-rich plasma, or PRP therapy, uses injections of a concentration of a patient's own platelets to accelerate the healing of, let's say, injured tendons, ligaments, muscles, and even joints.
And in this way, PRP injections use each individual patient's own healing system to improve musculoskeletal problems, but patients need to understand that there are many different treatment options.
This is going to be really informational. Here with more are Patrick Penny, President and CEO of EmCyte Corporation, and Miami-based plastic and reconstructive surgeon, Dr. George Vargarakis.
What's the difference between, let's say, PRP and stem cells? Because a lot of patients may think we're talking stem cells.
These two therapies are very similar. However, there are some distinct differences between the two. Platelet-rich plasma uses growth factors to heal wounds, and these growth factors are found within the alpha granules of the platelet molecule. When these alpha granules are concentrated in a clinical form and applied to a wound, they stimulate the reparative activity of the wound, ultimately increasing the ability for that wound to heal. Stem cells will do everything that a platelet can do, but they add a differentiating cell population to the mix.
Okay.
That is referred to as progenitor stem cells, which are regenerative stem cells. And when those are clinically concentrated and applied to the wound, they differentiate into the damaged tissue within the wound, ultimately supplementing that tissue with good and viable cells. So these two therapies, when combined together, they form a very powerful treatment application.
PRP, the growth factors, enhance the result of the stem cells. So when we like to give the fat injections to the patients for various indications, like for the breast cancer, for the breast defects, we're placing PRP into the fat. In that way, we have higher success for survival.
So Patrick, let me ask you this. Patients then, I guess, should know the type of PRP the physician is using, obviously, for recovery, because not all devices are, I guess, equal?
There is no performance standardization for PRP devices, but there is a performance standardization requirement for clinical outcomes. And most of these devices don't meet that requirement. Clinical research shows that in order to have an effective PRP product, you should have at least 1 billion platelets per milliliter. If you're treating a patient with 5 mLs, you should have 5 billion platelets in that treatment sample. Okay? It is not the only indicator for effective PRP product, but it is by far the most important indicator. I would ask patients to challenge their physicians out there and ask them, does the PRP device that's used to prepare my PRP, is it capable of producing 1 billion platelets per milliliter? And if not, they're likely not getting the full benefit of the therapy.
Well, doctor, you use EmCyte in your practice. Now, can you talk a little bit about its efficacy and some of your patient outcomes?
It's a combination. It's not just the system, it's also the doctor. Of course, having a very good, high-quality product like the EmCyte, it tremendously has helped me in my practice. I have solved difficult cases with the use of PRP, and also I have reconstructed difficult wounds with adipose stem cell tissue and fat. The way I'm harvesting the fat, I'm giving the fat to the machine and to centrifuge and using the EmCyte protocol, and in that way we're getting even more stem cells. And then we inject to have very good results. The best way to harvest and then to process the fat is a combination that we are doing right now with the EmCyte.
So Patrick, why is it lending itself to be actually the leader in autologous regenerative medicine?
20 years of innovation has brought us to modern technology in PRP devices, and that brings us to our pure supraphysiologic concentrating systems. That is our pure PRP concentrating system, our pure BMC concentrating system, and our Progenikine concentrating systems. These systems don't only meet, but they exceed the clinical threshold that's needed for effective patient outcomes. They go one step further to also look at the components within a PRP formulation that works counter to wound healing. These are glycemic substances, these are oxidative substances, and harmful inflammatory substances. And we have been able to remove those substances from our devices, which will ultimately lead to a much better outcome for a patient.
Well, now that patients know what to ask for, where can they get more information?
They can go to EmCyte.com to learn a little bit more about our company and what we do and the products that we offer. And then they can go to GulfCoastBiologics.com, where physicians can learn about the effective training programs that we have so that they can better educate themselves with the various therapies that we offer.
And I'm not going to forget those numbers. For every 1 ml, 1 billion. I got to remember those two.
Got it, exactly.
Thank you, gentlemen, so much for your time.
And of course, you can always go to our website, thebalancingAct.com, if you want more information.